And the Los Angeles Times has new guidelines for prostate cancer screening. The U.S. Preventive Services Task Force says men between the ages of 55 and 69 should talk to their doctors about getting the blood test that looks for markers of the disease. The test is not recommended for men 70 and older. The panel had previously advised against routine screening. Dr. David Agus heads the University of Southern California's West Side Cancer Center. Good morning, Dr. I was already confused by all of this, which is why I said website instead of West Side. Can you break this down for us?
I'm going to try. So 29,000 people a year die of prostate cancer, the second most common cancer cause of death in men. And there's a test, a blood test called the PSA test, where it's elevated, can indicate prostate cancer, but can also be inflammation or just a normal large prostate. So in the United States, they did a trial where they said to people, you get tested and you do whatever you want. And it didn't show a survival advantage because the do whatever you want arm, they got tested anyway. In Europe, they did the study, and what they showed is that people lived longer. In 2012, our government recommendation, the U.S. Preventive Task Force, said people shouldn't get tested because there's not a major survival advantage. But what has shown in that trial, as it's gone longer, is more and more people were saved. That being said, it's not a perfect test, but age 55 now to 69, you should have a discussion with your doctor. They're not saying go get it, but they're saying it's a value systems-based decision, and it really requires a talk with your doctor.
What am I going to get in that talk, though, that's going to make this less confusing to me?
Well, it's going to say that when you have this, there are chances of false positives, which means that it can be elevated for a reason not because of cancer. And then if there's a biopsy, not all prostate cancers actually need to be treated. And if we do treat the cancer, there's side effects to treatment. So it's really understanding the ramifications of making a decision. That being said, listen, I am tested. I believe in it. I see all the morbidity of cancer and people dying of cancer, and I'll do anything I can to prevent it. And I have the discussion with my patients. Most of my patients want the test.
So why does the panel recommend that you don't get it over the age of 70? You touched on it briefly.
Well, they look at, they say people with less than 10 to 15 years of survival, which classically at age 70, they shouldn't have the test because there's a delay between the diagnosis of cancer and when it will cause symptoms and potentially death. And so, if you're very healthy at 70, you probably should have it, although the panel doesn't say that.
What puts an average man at risk, higher risk for prostate cancer?
So African Americans, people with a family history, and people with certain genetic disorders have a much higher risk of prostate cancer, and the screening discussion in them is different. That being said, there are newer technologies now. You could have an MRI first, and that MRI of the prostate can actually look and visualize some of the cancers and guide the biopsies and reduce false positives. So the tests are getting better also.
All right, Dr. Agus, thanks very much.